So when we look at that environment that these children are being raised in, we see that there are risk factors for many children. Risk factors are inherited or experiential conditions that contribute to negative development for children. Now, everyone has risk factors at any point in their life, but it's children that have several risk factors or very intense risk factors at young ages that really have a huge impact on their development. And it's a negative impact. So we look at the risk factors here in the first box, and we see that poverty, single parent families, low education level of parents, some sort of disability, abuse, having very young parents or a parent, maternal depression, a difficult temperament for the child, and a lack of connections to community resources. All of those risks will lead to the first box, developmental delays, social problems, and health problems. Now, what we see is at any point, an intervention will make a huge difference on these risk factors. But if the child potentially continues with these risk factors with no intervention, they can turn into the box at the bottom: peer rejection, academic failure, dropping out of school, mental health disorders, and criminal behavior. And this is where we see that breakdown, that those very small risk factors early in life, if not met with some sort of remediation through either early intervention, through schools, through community resources, we see the process keeps getting worse and worse and worse for the child, and the eventual outcome is not one that is positive.